Hey, my name is Arya. I'm one of the third-year general surgery residents at UCSF,
And I'm Dr. Ed Kim, one of the colorectal surgeons.
and today we'll be talking about radiology for novices and how to read abdominal CT scans, and this will be the second part of a two-part series.
And so, like as before, the goals and objectives of this series is for us to understand the value of images as a tool for learning. It's not to teach you guys how to be a radiologist, because it's more of just a practical way to be able to deal with these very helpful tools. And in this case, we're going to start talking about the lower abdomen and the retroperitoneum. In the last podcast, we talked about the upper abdomen and the upper retroperitoneum. And
in terms of the organs that we'll be focusing on, we'll be going through the bladder, the prostate, and seminal vesicles. In addition to that, the uterus, vagina, and ovaries, which would be in the same kind of anatomic territory, although the images we'll show are in males, so that isn't a male, so you won't see that in this specific image that we'll have on the PowerPoint. Also, then the rectum, the sigmoid, and descending colon.
yeah, you're right. I think we're going to be focusing more on the bowel aspect of it than some of these other genitourinary structures. So let's start with our first slide.
Alrighty, so here we see
Mid-abdomen. Okay.
exactly the mid-abdomen. You have the kidneys there on the right and the left, and then we see the arrows pointing to the aorta and IVC.
Is this even a contrast CT?
This does look like a contrast CT, so we can see that the kidneys are pretty hyper-enhancing. So the contrast has gone to the kidneys, so this is a little bit more diluted and a little bit more delayed. But you do see the aorta and IVC that if you had a non-contrast and you compare it side by side, it would be much more dark, the blood there, than they are currently. Although this is not particularly bright. So the reason for that is it's important, just as an aside before we get into too much detail, is the phase of the contrast CT. So when we give contrast through the IV, it'll eventually come into the aorta after it travels through the veins. It comes into the aorta, and if you got a CT scan within 30 seconds after giving IV contrast, the aorta and arteries would be extremely bright. That's a CT angiogram phase. It's like getting an angiogram.
It's also called the early arterial phase, is that right?
Exactly, yeah. An early arterial phase is what a CT angiogram is. But in general surgery, a lot of ours is a little bit more delayed because we're kind of looking at the bowel and the organs and the portal venous structures. So what we do is actually, let's say an angiogram phase was after 30 to 45 seconds after contrast administration. If you're looking at appendicitis, you'll get a CT scan about 90 seconds after contrast administration. So the contrast is now diffused out from the arteries and gone into some of the veins. Now on this image here, the contrast has even diffused even more than, let's say, 90 seconds. So that's why the artery, the aorta, and the IVC are identical with regards to their enhancement and the amount.
Interesting.
So yeah.
Okay, so let's move on. So I think where structures that you want to think about are the right colon, left colon, and there's the ascending colon.
Yeah, we see the ascending colon there.
And how do you know it's the ascending colon?
So there's a few things that clue you in. One, that's in general the anatomic territory, given that it's adjacent and anterior to the kidney, so it's on the retroperitoneum in front of Gerota's fascia of the kidney. So there is a
what about the poop?
The poop is in there.
It's very classic.
That's classic for poop. So you have some like little bubbles of air, and it looks like poop.
Yeah. And then the descending colon, you got to find the other poop.
Yeah, exactly. You look at the poop there. It's on symmetrically the other side, and there it is. You see the poop, air bubbles, and some fluid.
Okay.
That's classic for poop.
Now let's go to small bowel. Small bowel can be a little more tricky, don't you think?
I do agree. Yeah.
Yeah. So
here, the small bowel, since it's usually in general can be decompressed, you'll see on the left there decompressed small bowel, and it looks pretty bright. And then even more decompressed small bowel on the right, that's even more decompressed. It's a little bright.
Yeah, and Arya, I think for some beginners, sometimes they have a hard time because there are all these dots, these decompressed small bowel dots. And they're all, some of the mesenteric vessels are almost as big as the dots. So that can be a little tricky.
Yeah, I agree. And you sort of have to remember, you wouldn't expect kind of like that small decompressed intestine on the right. You wouldn't expect a big blood vessel over there. So that kind of helps lead you to think about what that could be.
Big blood vessels are more central, whereas the ones out there. And then now we have an interesting, a contrasting one right there. That's a small intestine as well, but...
Yeah, we have an opportunity to see a fluid-filled loop of bowel. And the way you know that is because you have a rim of enhancing tissue around it. That's the bowel wall, because all the blood is going to the mucosa and submucosa. And in the middle, you've got a fluid-filled loop of bowel. And if you measured the Hounsfield units, which you can do on your own time.
Now you're getting technical.
Yeah, but it's good to know the Hounsfield units. If you measure the Hounsfield units in the middle, it'd be much less than on the bowel wall. Okay,
great. All right, so now this is the coronal view of the same patient or same basically anatomic region. And now you can see the ascending colon and the cecum much more clearly. Well, actually, we're starting out with the duodenum. Sorry about that.
Yeah.
But the duodenum is...
Yeah, you can see the C shape of the duodenum, as you guys all sort of know. The duodenum has 4 portions. With that arrows pointing, probably the second portion of the duodenum, and it comes around as a C loop, and it comes back up.
And there's a little bit of fluid in there too, eh?
Yeah, okay. You see the bowel wall, the duodenal wall that's bright, and in the middle it's a little darker. That's just some simple intestinal fluid.
Yeah, that's really great. And here's the cecum and the ascending colon, and on the left side you can clearly see the left colon. Yeah. And then you go down a little further, it's going to be coming in and out of the planes because these are cuts. You see the sigmoid colon.
Yeah, and then in that sigmoid colon, if you look at those little bubbles, actually, since those are on the bowel wall, those are actually diverticula. So that's sort of, and you can see it on axials pretty well as well, but you can clearly see those little bubbles. Those are diverticula there.
Okay, great. And lastly, there's a fluid-filled circular sac known as the bladder.
Yep, all the way down at the bottom, sitting right on top of your pubic bone and pubic tubercle. You can see the bladder.
And I'll take one moment here to talk about the different contrasts, because there's no IV contrast there, but this is the intrinsic contrast of the tissue, right? Fluid tends to be dark gray, fat is almost black, air is black, and bone is white.
Yeah, right? Definitely. You can see all 4 different major contrasts. You got air, fat, soft tissue / fluid, and then bone. Those are the 4 main contrast densities.
And then the IV contrast even further enhances and makes things different based on perfusion. So that's beautiful.
And one more thing. One more thing on this is to keep in mind when you look at CT scans on people that have not had colon surgery, the ascending and descending colon will always sort of be right in front of the kidneys because they're attached to the retroperitoneum. So that's why the cecum and descending colon are both, when we're scanning, they're sort of on the same plane, right? The sigmoid colon is going to go in and out because the reason for that is the cecum and descending colon, they're fused to the retroperitoneum. So you expect to find them in the same place.
Okay, great, Arya. So now we're down in the pelvis, and you can see the rectum and the anus, right, as you go further down. And you can see the sphincter complex, which is really cool. The levator ani, and then if you follow that down, is the pupa rectalis and the anus. So axial view.
Yeah, on the axial view here, we can see
the bladder.
The bladder there.
Yeah. Not too much contrast, IV contrast in this one. This almost seems like a non-con again.
Yeah.
With the fluid fill.
Yeah.
Fat, rectum, which is tissue. Maybe there is a little bit of contrast there, but it is soft. It's muscular tissue, though, so it's more dense, so more brighter. And then mesorectum, which is fat, which is the least dense, and so it's black.
And just look at it real quick for yourself. On the outsides of the scan, that's the outside of the scanner, it's very black. Then the next thing that's dark, but less dark, is the fat around the colon, or the rectum. Okay. So that all makes sense.
Great. And then behind the bladder, you can actually see those 2 slivers, which we don't have arrow for. Those are...
prostate. Or some of the vesicles there.
Yeah, very good. Lower down on a male, you got the prostate, you got the anus, and you have the sphincter. So there's the anus, levator ani going down to become pupa rectalis pretty much, and the prostate. Excellent. So here we are now. We're going to talk about the vasculature. So the main vasculature is the iliac arteries.
And it branches into the external and internal iliacs, aka the hypogastric. Then you have your IMA and its branches, which we'll look at. The superior rectal, also known as the superior hemorrhoidal, the marginal artery, and then you could also see gonadal and ovarian vessels, and then the ureters.
The ureter. Okay, so here we go. Here's our coronal view again. And I think you can start to, it's coming out in and out of plane a little bit, but they're the common iliacs, right?
Yeah.
Big vessel right there.
Yep.
And then again, in and out of plane is going to be our external iliac, right? Yep. There's the IMA, which you can follow right up to the origin in the aorta, and then the sigmoidal arteries that come off there.
And they're pointing towards the sigmoid down there with the diverticula that we talked about earlier.
Right, and then the marginal arteries along the colon. Mm-hmm. So that's pretty much it. And this is like a practice, as we discussed, right? I think it's really hard to look at scans without scrolling. I mean, it is a dynamic study, right?
Yeah.
So that's why we're providing you with these practice axial CT for you to scroll back and forth on your own.
And it's nice to get a system for yourself when you're practicing on things to look at, because just like chest x-rays, you're going to miss stuff that you're not looking for. So you want to focus on getting to each organ. So you want to start, let's say, from the bottom up. Make sure you look at the rectum, look at the sigmoid, look at the descending colon, look at all the colon. Make sure that you've told yourself you've seen all these.
Right. And that's what I'd recommend. I think for the large bowel, I think I would start at the rectum and then move on up. And then for the upper GI, start at the esophagus, go to the stomach, and try to at least get to the duodenum.
Yeah, go through you should be able to see all 4 parts of the duodenum and get to the proximal small bowel until it sort of gets decompressed and lost.
What about the vessels?
The vessels, I like to start from top and go down. I start at the aortic hiatus, and then you see your celiac and its 3 branches. Then you come down to the SMA. Then you can see your renal arteries, and then you can see your IMA, and just sort of follow all of those out and follow the branches as much as you can. Yeah,
I think for me, I like starting at the portal vein, SMB, IMB. I think that I find that helpful, and then the splenic. Anyways, I think so. We'd like you to be able to follow the bowel as much as possible. Although, like I said, we don't expect you to follow the small bowel for like jejunum. I think esophagus to duodenum, and then if you can follow the entirety of the colon, and then if you can follow the major vessels in the abdomen, I think that would be perfect. Or you'd be doing really, really well. Thank you for listening to this introductory podcast.
Yeah, have fun with it. Try and look at as many as you can. If you have patients that have CT scans and you're interested in them, you should take a look at them because you'll learn so much that way.